A very important news conference. It's been a couple weeks since we've had a chance to gather our healthcare team from all over Greenville and South Carolina to give us a report on what's happening in Greenville with COVID. So I'd like to say in all of these conferences that we started several months ago, it's easy to get information about what's happening across the country, indeed across the world. And while that's very relevant in many respects, we really don't have enough information sometimes about what's happening here locally in Greenville and where the trends are. And that's what we bring together from time to time, the representatives that you see here today to tell us what's happening in our community and what we need to do about it. We have with us today Dr. Brandon Traxler, who's now the interim director, we're proud to say, of public health for DHEC, Dr. Eric Osmond of Prisma, Dr. Wendell James of Prisma, and Dr. Marcus Blackstone of Bon Secours St. Francis. I just want to make a comment up front. We all received some good news recently in the economy with the quarter of, I think it'd be July, August, and September, showed surprising strength in the economy and an uptick in savings and in people's income, and that's good. And that reflects, apparently, some effects of people going back to work or going back into the world a little bit in the last several months. And that's all good, except for one thing. Those trends that we saw at that time in terms of the COVID around the country were going in a different direction. Things were getting a little bit better. Since that economic data was released, that we can be happy to see, things have gone in a different direction. Because the fact is, for the last month or two around the country, especially in the Midwest, now increasingly in the Northeast, and then in some other places, I saw El Paso, Texas is in a real state of crisis, the trends have been going in a different direction. And that, unfortunately, is the fastest way to end the recovery that we might have been seeing, to stop it in its tracks. And that's the real tragedy of all of this, that the state of the economy, our ability to live normal lives is in our hands. And it still goes back to how we treat this virus. And we're going to talk about that here too. I want to say locally, by the way, in the city of Greenville, we saw an improvement in the hospitality tax revenues the quarter back. That is, people going out to eat, hopefully safely. And again, it's the same thing. If we're seeing good trends there in the past, we're not necessarily going to see that continue if the situation with COVID isn't better contained. We don't want to be where Europe is now. Europe went through a period of some recovery. The situation with the COVID getting much, much better. The economy then getting much, much better. And now France and Germany, UK, Spain, Portugal, they're looking at lockdowns again, or versions of lockdowns. So the economies in those countries is not going to look so good in a few months. So there it goes again, the circular tragedy. But we're going to find out what's happening here in Greenville. Where are we? Are we different from the Midwest? Are we different from these other points around the country where the trends have gone in a good direction and now in not a good direction? Where are we? And I think I just want to always say thank you to our local healthcare professionals, because from the very beginning, Dr. Blackstone, Dr. Osmond, Dr. James have all said the same thing. They've emphasized that the decision is up to all of us. We make the choice to wash our hands, to maintain social distancing, being intentional about it, and most importantly, wearing a mask especially when you're inside. It's our choice. We determine where the COVID goes. We determine where our economy goes. And I think we're going to hear more of that today, I'm sure.